Good afternoon. This is a health security brief to Governor Tina Kotek of the state of Oregon. Global health security is a national health security that gives groundbreaking innovation and opportunity to thrive in prior to and during pandemic, epidemic, or outbreak situations that affect Oregon State's health security. Oregon State security relies on the Department of Health and Human Services' ability to converge emergent resources and respond to civic health-related outbreaks. From response time of activating the National Guard to the immediate response of EMT and firefighters, we see how to improve in practice to prevent loss of life. Regional security may be threatened by viruses, plague that crosses state lines. The opportunity to direct management of resources during a time of crisis and be prepared to face socioeconomic, medical, urban, and suburban disease tracking helps keep Oregon at the forefront of emergency response. Global health security as it pertains to Oregon's public health reinforces safety, security of civil resources, and implementation of statewide emergency response to medical outbreaks and prevention of disease throughout our state. Oregon's role is to prepare a rapid response plan or standard operating procedure for handling critical response initiatives as they arise and prevent morbidity and mortality of our citizens. DHHS is the overacting authority responsible for population health and wellness in the state of Oregon. Areas include environmental health, public health administration, epidemiology, and vital statistical data to lead the way for local health clinics to operate effectively in communities. Public health departments are the tip of the sword, the pinnacle of health and wellness within a defined area of operation that prevents disease, responds appropriately to safety and health challenges as assigned by DHHS. One instance is recognizing emergency radioactive responses at Hanford Nuclear Facility. There is exposure to radiation where iodine-131 was carried by winds to surrounding areas and deposited on vegetation. It was then absorbed in the milk of cows and goats that grazed on the contaminated vegetation. Drinking contaminated milk caused most of the radiation dose for most of the exposed people. People were also exposed by eating contaminated fruits and vegetables and by breathing contaminated air around Hanford Nuclear Facility. One emergency response plan is necessary for the health and safety as well as in global security for the Hanford nuclear site in Central Oregon. Hanford was active from 1944 to 1957 and is now an unclassified cleanup area for plutonium and cobalt-60 radioactive waste and disposal. If not properly handled, the release of iodine-131 can ablate thyroids of residents within up to 100 miles of the site dependent upon wind. Wins Hanford 2026, no author. Cleanup of Hanford Nuclear Facility is essential to Oregon's health and welfare and is still an issue into the early 2020s. A second issue in global health security is the outbreak of COVID-19 that mutated from Delta to Omicron and continued to change strains. The emergent change of the messenger ribonucleic acid pose a significant threat to the health of the United States of America throughout the flu season. The third issue is the rapid transmission of measles that through unvaccinated children from Mexico's immigration to Oregon. The parents are often unaware that they need to minimize the potential outbreak of measles by giving their children an MMR vaccine, measles, mumps, and rubella. This will provide herd immunity to a majority of Oregonians. The public health issue in Oregon I've chosen for this presentation is measles. During your term, we may have to respond to an outbreak of measles in Oregon. Are adults and children vaccinated with measles, mumps, and rubella? And we've got to ask ourselves, are migrant workers' children vaccinated? when they come up to work in the spring and fall. Measles is a virus often transmitted by children who come into contact with each other in grade school. It is highly contagious, according to Misson et al. 2020. It crosses borders rapidly and can cause an outbreak with each case. Everyone in contact should get a dose of measles, mumps, and rubella. It is so dangerous that it has to be reported to the National Notifiable Disease Surveillance System, according to the CDC, Center for Disease Control. Since the beginning of 2026, 2,134 cases of measles have been reported across the nation. Although the outbreak was 23 cases in Oregon in 2026, the opportunity to stop the outbreaks prior to transmission to other states remains high. Herd immunity is best practice and is achievable. We can see under an electron microscope here the measles virus and how it looks and attaches on to other white blood cells and fights the battle in our body when our children get sick. Measles. Historically, 3 to 4